I put my head down and I think, I need out of here. And I started doing the work. I mean, I'd spoken to Graham probably a few years beforehand. I don't think he even remembers that, but like I sort of inquired about getting out soon because I saw people having problems getting jobs. I mean, that's a strange thing. I know you guys were talking about it earlier, that you have trouble getting work after concert, and it's insane for a doctor not to have work. So I did that early on, put the head down, got IELTS exams, all of those things.
In South Africa until about 2022. And then it just became really difficult to make ends meet here. I worked for a large practice just outside Cape Town, and I found that I'd just be spending all my time working, being too tired to spend any time with my family in the evenings, any meaningful interactions with them, and working almost every weekend. And really struggling to pay the bills. So, then COVID came along and I got ill and I could not work so hard anymore afterwards. So I just decided to make a change, and coupled with, everything's been happening, I think there was always the political uncertainty that made us think maybe it's a good idea to look at other options. In the end, I decided not to move to Ireland permanently. I still live here and I like it here, but now I've got the freedom to work there and come back, and I think I've got the best of both worlds.
Great. Daniel, let's start with you, just talking through your working relationship with them.
Okay, so I'm a GP. I work at a practice in Skibbereen in the south of Ireland. So there are 4 other permanent GPs. They're looking for more doctors. They are happy to have me whenever I choose to go. So they'd like to have me all the time, but my family are here, so I go back and forth, and I do 6 weeks there and 6 weeks here. So when I'm here, I do locums, whatever, just locally around where I live. And when I'm there, I know the practice now, I know the people, the townspeople know me, and I have a place that I can always stay. So it's easy for me. I fly into Cork, and then from there, it's a quick bus ride into Skibbereen, and that's where I work, and it's GP practice, very similar to what it would be in Cape Town.
Very good. Similar question to you, Reece. If you could talk us through where did you start?
Yeah, so I started in area of Galway County, at a hospital called Portiuncula University Hospital. I started in a senior house officer, so SHO post. I think I started as a level 3, so grade 3 of the senior house officer sort of category, in emergency medicine. Graham got me a great job there in emergency medicine as SHO. Enjoyed it. It's a great place. I mean, I think if you do like emergency medicine, it's very segregated. They're very good. So they get the anesthetic team to intubate patients, and you're sitting around, in the emergency with the anesthetic team there, and the surgeons doing the drains, and you sort of, it's, I mean, because we're training for doing emergency. I think if you've been to any government South African hospital, I think all of you, if one of us dropped dead, you'll take care of us. But yeah, so I started in emergency medicine, got a little bit disgruntled with, a bit of border, but it's a lovely place. I mean, you'd be happy to go there as a patient to a government hospital. It feels very, very medical. It's very private. They've got equipment, they throw away needle holders. It's like it's one-use only stuff. I wish I wanted to clean one of them the one time. Sort of sitting back there, but yeah, so they've got lots of resources. It's a great environment. I love that hospital, but I knew I wasn't sort of set for a career in emergency medicine. I always wanted to do obstetrics and gynaecology, and I wanted to get specializing as soon as possible. So I took it, in my stride, and I went around the hospital. I think one of your speakers was saying, chat around the hospital, speak to the other departments, and I went to the obs and gynae department and chatted to them. I didn't get a job in that hospital. I got a job in another hospital very nearby, and I'm currently now a senior house officer, grade 4 in obstetrics and gynaecology. So that's where I am now. And in June, July, I think we'll chat another question. Depends how much time we have. I'm going to be on the specialist training from July this year. So that's great.
Well deserved round of applause, I feel. That is a phenomenal synopsis first of your experience and showcasing what you've done, but also the journey you've gone on, pretty rapid journey to get onto the specialist training program, which we definitely will touch on. At the beginning, you both alluded to your motivations to move to Ireland, so I think we've got that crossed off. But we'll go back to yourself then, if we can, in terms of your first impressions of Ireland.
Wait. Don't bother taking an umbrella. You need a jacket with good hood and rain trousers because the rain comes horizontally. Doesn't come from southern umbrellas. I thought to me it looked like rural UK, if you know the UK. It's pretty if you like green fields and meadows and that kind of thing. People were super friendly. They're super friendly. They're the friendliest people in the world, I think. They're really easy to get on with, and they take an interest in you. They always try to help you.
They're friendly. There's a kindness about them. And what is the other thing I found? Even some of the patients, I think they love the South Africans. They love our accent. I know our accents are okay-ish, you know. I've never been such a fan of our South African accent, but they're obsessed with it. So sometimes, I'm obviously, I'm in Obs and Gynae now, so I get patients come in with their husbands or their partners, and they're having a debate between. I think out of 5 patients, every 3 out of 5 patients I see with their partners are having a debate. Listen, we want to know if you're from Australia or South Africa. We used to settle this debate for us. It's like we have a great chat all the time. And when I say it's South African, the husband or the wife know, oh geez, I knew it was you. It's just like a culture that you've never really had here. It's like the interactions, the social interactions are so cool. Like you get to meet so many people, and I don't know, maybe I'm like dragging my feet there and spending like 45 minutes chatting to patients when I should be, going through. But you've got the time to do that, and it makes medicine a lot more social and enjoyable. It's like you're not just let's get through the clinic,
Working in a hospital setting in Ireland versus back home, but what might have been the starkest difference that you found in your time in Ireland versus working?
There's been so many. The first would probably be the hours. The European Union or the working time directive. It's not completely initiated in Ireland. Like I've still done 24-hour calls, but not 24-hour calls of actual true 24-hour work. Where in Barry-Barnett we were doing. You get 15 minutes standing on your feet eating a sandwich in the corner and you're running back to work. Like the hours were totally different. Like there's the Irish doctors that are working with you are complaining, oh, I'm so tired, I'm exhausted. It's like post-call, you got your day off. You wouldn't go sleep after a shift in Ireland, and you struggle driving home. It's a different world, and they want to look after you. They know, we don't want our doctors to be tired. Go to sleep. On the 24-hour shifts that we still do, because some of the smaller rural hospitals still do them, they're phasing them out. I think they're penalising these hospitals, like good funding to phase it out quickly. I know Dublin, I know the big Cork areas, of all they phase it out. I don't think they do more than 13 to 16 hours. I still do 24-hour calls only on weekends now, which is a breeze. And then most of the time I'm studying in my room, which is like a nice little fan, got a little dressing table. There's a mirror there. And it's like a private hospital. I've never worked in private, so I don't truly know, but I've been in a private hospital. The walls are clean. It's neat. That's the first difference. The other difference is the resources. It's the amount of doctors you have at any given time in any area. When I was in emergency or obstetrics gynaecology, it's just wonderful. Like you're never alone. Like whether you're a registrar and you think, oh, a registrar in South Africa is a different story to a registrar in Ireland. They've got other registrars and the consultant and us SHOs to work with, and it's just a lovely community to work with there. I love it.
Whenever you want to come. And then take holiday or do some work elsewhere. You can obviously get to know the country and decide where you want to settle. So I did a few locums in Ireland, and then when I arrived in Skibbereen, I thought I'd liked it there, and the people were friendly, the doctors wanted me there, they asked me whether I wanted to stay, and then they bought me up. They paid MatchMedics a certain amount of money to have me there and not move around anymore. So you can definitely get to know Ireland first if you want to do it that way. You obviously also get to know the way that they work, get to know the various systems that are in use in private practice there. So it gives you a good background. In my case now, I don't travel around anymore, but around Ireland, I'm just in the one place. But I still get to come home often, and it works for us.
Great. And just for the crowd, it's worth noting the local piece is primarily for GPs. That need is definitely greater. We'll stick with you, Daniel, and ask you a final question on your side. Do you ever see a long-term move to Ireland?
It's a difficult one. I'm not sure whether we would, but it's certainly nice to know that that's a possibility, so that if things get really unpleasant here, or for whatever reason we can't stay here anymore, then we've got somewhere to go. So, I can work in Ireland, I just have more options available. So maybe once things change in terms of my own family, once my son leaves school, maybe I will move to Ireland, but I don't know.
No doubt, when you make your mind up, Skibbereen will be very happy to take you along.
Yeah, and I like it there. The people are super friendly, I mean, you walk down the street and they wave, they say, "Hey, welcome back," when they see you. If somebody, I walk to work in the mornings, and if I walk past cars that are damming up, we've got traffic there for some reason in the town. The cars dam up, and the guys will wind down their windows and say, "Okay, my eye's better, thank you very much," whatever. And we don't get that here so much, so it's a really pleasant place to go back to.